fight that we have here in Springfield, in D.C., in Chicago, is that we must stand together, and we can't let no mother take that away from us.
State Senator Robert Peters out of Chicago during an Illinois Coalition for Immigrant and Refugee Rights rally that happened inside the Capitol yesterday, all while the governor, J.B. Pritzker, looks to eliminate the health care benefits for immigrant adults subsidized by taxpayers for the forthcoming budget. But all of that as well under the cloud of an audit that came out yesterday from the Illinois Auditor General showing that the state's program giving subsidies to non-citizen migrants, it ballooned. Go to thecentersquare.com, find the Illinois page. You'll see the headline of the story I wrote yesterday. Audit shows Illinois' non-citizen healthcare subsidies ballooned. All right, so let's get into this. All right, it's obviously something that has been contentious at the Capitol, with Republicans opposing this as something taxpayers can't afford. And it was an effort that started back in 2020. Illinois, I believe, became one of the first states to offer up taxpayer subsidies for non-citizens to get health care. And they did it first for seniors, and then they expanded it to adults. And if you recall, a couple of years ago, the Pritzker administration went to go put caps on how many people could be enrolled in that program. Not really sure that helped out, as we've got this audit from the Illinois Auditor General, which you can link to in the story I wrote yesterday. And let's read through this a little bit. The Office of the Auditor General report. Key findings: actual enrollments and actual costs exceeded the initial program estimates for the Health Benefits for Immigrant Seniors and Health Benefits for Immigrant Adults program. Regarding estimated number of enrollees, they pretty much were doubled, if not more than doubled, what was actually estimated. And you can see there, if you're watching live, some of the estimates, right? The cost as well, upwards to 286% higher than estimated, right? So the health benefits for immigrant adults was estimated to be $68 million. But over a 2-year period, it ballooned to $262 million. All right, 286% higher. You can see the other cost overruns there. But it also goes on to spell out that during a review of some of the enrollee data, auditors found 6,000 enrollees designated as undocumented who had a Social Security number. They went to HFS, Healthcare and Family Services, for the state of Illinois, and they reviewed some of the things and determined that of the 94 they reviewed, the 6,000, 19 should have been recorded in the system as lawfully present. So again, some of these problems with, ensuring that the various individuals who are in this are properly enrolled. I mean, there were others who, for instance, the audit shows were not of the age to be in the seniors program, for instance, right? So they found 688 enrollees who were not above the age of 65. They took that to Healthcare and Family Services. They only looked at 151 after being told of the nearly 700. And it was determined that many of the errors occurred from incorrect birth dates provided by the enrollee. So poorly managed, and the checks on whether or not these individuals were eligible, something that didn't really happen, apparently. State Representative Amy Ellick, who's on the Audit Commission, and this particular audit from the Auditor General was a result of the Audit Commission approving an audit of the program. Amy Ellick yesterday on the House floor got up and just made sure that all the legislators that heard her voice in the chamber were fully aware of the audit that took place and the results that came out yesterday.
I'd like to let the body know that the Auditor General today released the results of an audit that he was directed to do by the Legislative Audit Commission last year related to the estimates and costs of the HBIA and HBIS programs for 2021 to 2023. As the House Republicans predicted, the audit found alarming and astounding differences in the estimates of the program versus the actual enrollment and expenses. The governor's own budget for fiscal year 26 acknowledges that we cannot afford the programs and that we have far outspent any estimates, which is an affront to the hardworking taxpayers of Illinois. In addition, the program was found to have eligibility errors, which added to the costs, and the program also had poor internal controls in many ways. It is not enough for us to say, "I told you so." We must do better. Now is the time, and this is our opportunity to work for taxpayers, not promote fraud and overspending. I hope that's something that all lawmakers can get behind. Thank you.
So will there be some controls here? Will there be continued taxpayer cost here? These are the type of programs that Republicans say the governor put into place and ultimately is attracting non-citizens to the state of Illinois. And keep in mind, the state of Illinois for 10 years lost population. Except for the 11th year, we gained population. It wasn't because of people moving from Missouri to Illinois or moving from Indiana to Illinois. Actually, the domestic out-migration was still tens of thousands of people moving out of Illinois to other states. Why we gained population in the 11th year was because of 100,000+ people moving to Illinois from other countries. Right. So interesting to see that. But the governor was asked about the audit of the health benefits for immigrant seniors and health benefits for immigrant adults program. And he says that it doesn't tell the whole story.
So I think the thing that is missing from the reporting, and what I would point out to you, is that, number one, people's immigration status changes. During the course of a year, you've got people who weren't who were eligible for the program, who became uneligible for the program. And so you're continuing to, even though you expect that people will move on because, well, it may be their immigration status, it may be because they got a job that has health care coverage associated with it, but you expect them to move on, and maybe they didn't move on either because they didn't know they should. But that happens, I hate to tell you, on Medicaid as well. It's why we do every year redeterminations, and we did it with this program as well. One of the reasons that we even know about some of those people is because of the redeterminations. So people get removed from the program as a result of the redeterminations, but before they got redetermined to not be eligible, they were still on the program, and that cost taxpayers money. So that's a lot of, I think, what I would say about that. But the broader context is people need to get health care. I am in favor of universal health care. However that comes together, and we can talk about the myriad ways that we can do that. But people don't go get health care, get treated when they don't have a problem. And so it's some evidence anyway that there are an awful lot of people out there who need coverage, who aren't getting it, or who will do anything to get it. And I think that's a sad state of affairs in our society.
So the governor's advocating for universal health care, something that obviously would come at a pretty exorbitant taxpayer cost. Instead of relying on private health care for individuals and having some kind of stopgap for those who may fall through the cracks type of thing. So not the last we're hearing of this, right? Because as I said earlier, the governor has proposed in his budget proposal that he's going to eliminate the health benefits for immigrant adults. So those are the individuals, 42 to 64. He's going to eliminate that program for what he estimates is a cost savings of tens of millions of dollars. But as we saw, those estimates from the Auditor General were way low. But he's going to keep the health benefits for immigrant seniors program for people 65 and up. But as we saw, cost controls and efforts to regulate the overall costs, not that great. A lot of people slipping through there. So will we see more of this? Because you have a contingent that arrived at the Capitol yesterday, the Illinois Coalition for Immigrant and Refugee Rights, ICER, as they call themselves. They had about 150 plus people there rallying inside the Capitol. And you can see here just some of the video of the individuals inside the Capitol hallway rallying together. They talked about how they need more progressive revenue. All right. So we're going to hear a lot more about this, quote, progressive revenue as more and more of the budget negotiations continue and people are seeking added costs and extra costs onto taxpayers. They're going to be saying, hey, we need more progressive revenue. They had legislators there to support their cause, which included progressive revenue and making sure that non-citizen migrants get subsidized health care. People were even demanding universal basic income for certain individuals. Well, State Senator Mike Simmons from Chicago, he addressed the crowd yesterday and shared his thoughts on what needs to happen in relation to ICER's agenda items.
And as a son of an asylum seeker from Ethiopia and somebody that's from a proud immigrant community born and raised in the city of Chicago, I'm looking forward to fighting with you. I'm looking forward to fighting with ICER. I'm looking forward to fighting with my colleagues that are standing right here behind me today to make sure that we fully fund the immigrant services line and get that increase that we want, to find that progressive revenue, and to fight for other awesome bills that my colleagues that are supporting, such as Safe School for All and all of the wonderful platforms that we have in this group this morning. So thank you so much. Go get them.
Again, a rally at the State House with the Illinois Coalition for Immigrant and Refugee Rights. They also heard from a variety of Democrat state senators and state representatives. All they're saying that they're fully behind ICER, which is going to be interesting to see when we get to the budget deadline that they have to pass this. Are they going to include funding for immigrants, adults, to get taxpayer subsidized health care? Again, something that the governor wants to push back against and end in his particular budget proposal. Well, State Senator Robert Peters, he got up and he shared some expletives. I did have to edit this. We're a family-friendly show, after all.
Good morning. I'm State Senator Robert Peters of the 13th District. And I look at this room and I see beautiful solidarity that's going to kick some fascist ass. We're not going to let the people in D.C. divide us up. Right. In Springfield, we stand in unity, in solidarity, connected. That's the beauty of this room, of this space. And those in D.C. who try to divide us up and break us apart, I can tell you right now, in Illinois, with these groups of people, with all of us, we are the firewall that protect our communities. Yeah. So the fight that we have here in Springfield, in D.C., in Chicago, is that we must stand together, and we can't let no mother take that away from us.
So Peters has been known to share some expletives, even on the Senate floor. Probably not the last time we'll hear expletives from him on this issue. But that's just a sample of the 15 to 20 different Democrat lawmakers that got up to speak. And, listen, the Democrats have supermajorities in each chamber. And one thing that's important to note is for the budget deadline of May 31st, they only need simple majorities to pass things. So we could see some Democrats being given cover to vote against the budget. Say the budget comes out and it doesn't include the health benefits for immigrant adults. There might be enough Democrats to support the budget to get it across the finish line with simple majorities, while allowing state senators like Robert Peters or others, or state reps like some other Democrats from across the state, to not vote in support of it, but the bill would still pass. So then they could say, hey, I voted in your interests, non-citizen migrants, part of the ICER coalition. So interesting to kind of play that political maneuvering, something we'll be watching, obviously, as we get close to the budget deadline, which is May 31st at the State House. But Republicans, they obviously, as we heard from Amy Ellick, have serious concerns about this. Senate Minority Leader John Curran yesterday during a news conference, just again saying this program, taxpayer subsidies for non-citizen health care, the state can't afford it.
This program started in December of 2020. They did not start seeking federal reimbursement for eligible services, like emergency services, till March of 2024. There you go. That is not properly running or administering or taking care of Illinois state taxpayer dollars. No other state in the nation has a program like this. We are the only state that puts this burden on Illinois on their own state taxpayers, taking this on. And to not run it properly and to have these large cost overruns, that's how you end up with a budget deficit. That's what's crowding out spending on education. That's what's crowding out spending on other components of the state budget.
So you got Curran laying that out, but just so you know, the overall cost for the programs, $1.6 billion since its inception. $1.6 billion. That's just for the health care for immigrants, subsidized by the taxpayers. That doesn't include the welcoming centers, the assistance for lawyers, the housing, the education, the food, and all kinds of other benefits that taxpayers have been subsidizing for years now. All right, so something we'll definitely be watching closely here with Illinois in Focus Daily. Like, subscribe, hit that notification bell, wake up with us each and every weekday morning. I'm Greg Bishop. Follow me anywhere. Just search Bishop on Air.